My name is Jaylene Harrier, and I'm here to discuss the rising nurse vacancy rates at Northeast Georgia Medical Center. Northeast Georgia Medical Center is the #1 heart hospital in Georgia. It provides many incentives to its nurses, such as Clinical Ladder. Clinical Ladder is a 4-tiered system, starting with Level 1 as an entry nurse, all the way to Level 4, which is an expert nurse involved in many things within the organization and who has a higher degree. They also offer professional development opportunities such as tuition reimbursement, scholarships, and reimbursement for professional certifications and conference attendance. In October of 2017, the system went live with a new electronic medical record called Epic. Epic allows all 3 hospitals, as well as clinics and long-term care facilities, to all be on the same platform and access a patient's information. We also have a nursing shared governance model called Voice and have developed a professional practice model. This year we initiated new things such as nurse-provider rounding, interdisciplinary team huddles, and bedside shift report. These 3 initiatives have increased communication between nurses, providers, and the patients, and has increased patient satisfaction scores. We also have an elite RN residency program where we recruit new nurse graduates from area nursing programs, as well as an upcoming GME program, which will allow us to have medical residents on the campus. The medical surgical vacancy rate at Northeast Georgia Medical Center continues to rise despite recruiting efforts made by the Human Resources Department. Research shows that many nursing schools turn down applicants due to lack of resources. This has forced NGMC to think outside the box when trying to recruit nurses to the organization. Many forms of communication and action plans have been attempted by leadership to understand the barriers for the decreased number of candidates applying to these positions. Inadequate staffing has led to serious safety events that in turn has led to significant increases in healthcare costs. The purpose of this presentation will to describe these actions that leadership can take to fill the vacant positions and explain how the team will apply these decisions. It will discuss leadership strategies that include a multidisciplinary approach, team collaboration, and the evaluation of these strategies to ensure appropriate measures are taken place to recruit staff to the organization. The ultimate goal of this plan is to decrease the medical surgical services vacancy rate by 10% by the end of fiscal year 2019. This slide shows the SWOT analysis that was conducted. Strengths include the new initiatives, the nurse residency program, and the upcoming medical resident program, the opportunities for professional development, and the voice shared governance model. Weaknesses include the high vacancy rate and the lack of candidates applying to these positions. Opportunities include using the nurse managers to help with recruiting efforts. Threats include the inability to compete with the Atlanta market with the salary ranges. So how can we reach our goal? The first thing is managers can offer to screen the candidates themselves. Currently at NGMC, the recruitment team conducts the initial screening of candidates after their application is processed. Allowing the managers to conduct these interviews will allow the recruiters the time to process applications and provide the managers with the authority to advance the candidate to the next level of onboarding, which is the one-on-one interview. Another strategy is that the manager can trial the ability to offer the position to the candidate on the same day. If occupational health and compensation are available, the manager can move forward with the job offer, ask compensation to make a monetary offer, and send the person to occupational health to complete the onboarding process. This process can allow for an earlier start date and lessen the vacancy rate quicker than the traditional onboarding process. If the candidate is unable to complete the onboarding process on the same day, such as scheduling conflicts or multiple candidates applying for the same position, the manager will complete necessary tasks within 24 hours and get back to the recruitment department with a final decision. The evaluation of this process would need to be documented and reviewed on a regular basis to look at barriers that impede same-day onboarding. Another tactic a manager can do is play a part in the recruitment of our nurse residents. NGMC is proud to offer a nurse resident program to all new graduate nurses who are accepted to the program. Allowing the manager to screen, mentor, and check in with these nurse residents can foster an environment where they can be drawn to certain units and help fill the staffing gaps. In order to execute this plan, the clinical staff, nurses, and assistants alike must maintain buy-in of the process. The nurse manager would have responsibility in screening candidates, therefore the staff must trust the manager to make good decisions for the unit. One way the manager could obtain buy-in would be to include the staff in the interview process. The candidate could meet with the manager first and then meet with a group of charge nurses, staff nurses, assistants, and secretaries. The manager would gather feedback from the staff before making a final decision of hire. On a monthly basis, during staff meetings, the interviewing tool would be evaluated for change in order to better screen candidates for the positions in the future. The key stakeholders are listed here. From the chief nursing executive to the clinical staff, each member of this team would be affected by this process. So how do we communicate it? The first step would be to take it to the nursing shared governance model, that voice structure. If the clinical RNs and the leaders agree and approve the process, it would then move to the managerial leadership assembly known as VOLA. Again, communication should also be spread by the nurse managers through their monthly staff meetings. How do we evaluate it? First, the manager should provide feedback to the Human Resources Department as well as the recruiters on what is going well and what could be considered to be improved upon. Also, there are monthly R&R dashboards that are sent out to the leaders. This R&R dashboard separates vacancy rates by department, hospitals, and the system as a whole. It is a great way to track progress on a monthly basis to ensure the process is working. Although the nursing shortage continues to grow across the country, we must do everything we can to keep our patients safe with adequate staffing. Between the retirement of baby boomers and the overwhelming flow of candidates to nursing programs that cannot support the flow, nurses are working harder than ever before to keep up with job demands. Leadership must take action to help ensure adequate staff on their units and provide for the health and safety of their staff. Nursing vacancies will continue to be a problem for years to come. Leadership must look at ways to engage staff and provide relief when staffing issues arise. We must protect and support the staff we have now.